Good afternoon, everyone. I think we're going to get started. So, welcome, everyone. Good afternoon. My name is Dr. Philip Chan. I'm a physician here at Open Door Health. I serve as Chief Medical Officer. Thank you all for joining us on this important day. I want to start off today by thanking the Governor. Thank you so much for joining us. And the Governor's team as well, who was really instrumental in supporting these efforts. So thank you, Matt and Andrea and the rest of the Governor's team here today. Our Executive Director, Dr. Amy Nunn, could not be here today, unfortunately. She asked me to let you know that we were all so proud to lead this effort here at Open Door Health and RAPHI. I would like to thank several people today on behalf of Dr. Nunn, myself, and the whole Open Door Health team as well. We would like to specifically thank Senator Melissa Murray, Senator Joshua Miller, and Speaker Joe Shekarchi, who were really instrumental in pushing this bill along. We are so humbled and grateful for their support of this bill, as well as all the legislators who supported this. I want to acknowledge some of our reps and senators today. We have Tier Mack, we have Ryan Pearson somewhere. We have Bridget Valverde, we have Brandon Potter, I think I saw, yep, Representative Potter, and Representative David Morales. So thank you all for your support of Open Door Health in this bill as well. So much appreciated. I also want to specifically thank our patients, and that's one of the reasons why I'm here today is for the patients, because this is one thing that we kept hearing time and time again. You know, PrEP's been approved since 2012, so it's been over a decade, and this bill is meant to address a lot of the problems that we've been hearing. I also want to acknowledge the Health Department. Dr. Bandy's here today, Director of the Health Department, and members of the team, Seema Dixit and Joseph Wendelkin, hiding over there in the corner. And thank you to the Health Department for their tireless efforts across the state. And thank you to EOHHS as well. I know that Paul Liberti is here somewhere. Paul, thank you for your support as well of Open Door Health and your efforts to address HIV across the state as well. So we are here today to celebrate a major public health win for the state of Rhode Island. PrEP and PEP are both really important public health interventions to help people who are HIV negative stay HIV negative. They're going to have tremendous benefit both for our patients here as well as really for the entire LGBTQ community across the state of Rhode Island. These bills address things like cost, which are a major barrier, prior authorizations, and I think most excitingly, they also cover injectable PrEP, which is one of the big advances for HIV prevention, and cost has really been the biggest barrier there. So we're really excited that this bill will hopefully ramp up injectable PrEP here in the state. This law is one of the most comprehensive in the country, and so I just don't want to underestimate that this is really a big step forward. And finally, I also want to thank the Open Door Health team. So the Open Door Health team, many who are in the back there, are the ones today who actually care for our PrEP patients and prescribe PrEP and do the ground level work. So let's give it a hand of applause for our Open Door Health team. Several of us started the first PrEP program here in the state of Rhode Island back in 2012. And it's due to many of the efforts of people in this room as well. We are, importantly, one of the top 5 states, according to the CDC, for PrEP prescribing rates. So due to these efforts, we've had a lot of successes in Rhode Island, and this bill just builds upon that. And I was reminded as I was preparing for this that Richie DeFilippo, who's standing there in the back, so Richie was Mr. Gay Rhode Island in 2013, and I still like to say, and it's probably true, that half of Rhode Island is on PrEP due to Richie's efforts. So thank you, Richie, for your efforts as well. Thank you, thank you. And finally, I want to acknowledge all my providers and all my colleagues. Dr. Kluvin's here representing CFAR, Brown University, Lifespan, one of my ID colleagues, OBGYN, but one of my HIV colleagues. But there's a lot of us out there that prescribe PrEP and have really been fighting this battle for a long time. So thank you to all my colleagues, all the primary care providers out there prescribing PrEP. We are one of the states that is closest to ending the epidemic, and that is exciting. And again, this puts us one step closer. So with that, I'm going to end. I'm pleased to introduce Governor Dan McKee. Thank you for being a supporter of Open Door Health and all your work towards health equity, and thank you for joining us today.
For your leadership, and I know how important you've been to the state as early in as governor, and the role that you played during the pandemic, and today continuing that leadership in an important way. So thank you, Dr. Chan. good afternoon. I'm happy to be here with all of you here today, hosting, at the Open Door Health. And you have a wonderful clinic. I've been here multiple times, and that serves an important community in our ocean state. And today we're here to sign legislation that will not only save lives, but it will also help to reduce the spread and transmission of HIV. We have a particular connection in our office in Mashpee. Matt testified on this bill and showed some leadership from our office to move this across the finish line, and we're very happy to have leadership like Matt. According to the Department of Health surveillance data, over 3,000 in Rhode Island are infected with HIV/AIDS. 91% of the HIV and AIDS cases impact people between the ages of 30 and 50 years old. And as mayor of the town of Cumberland, where I was very involved with Colleen Scanlon, right, in the House of Compassion that was actually dealing with AIDS, and Larry knows, for being from Cumberland, how important that house was, and anybody that's been involved in this work certainly knows about that work that was happening during the time that was, not even as an advantageous type of time where there was a lot more pushback than there is today, yet there is still enough pushback that we need to defend ourselves in many ways. The good news is that thanks to the science, there are medications on the market that can reduce the HIV transmission rate to almost zero. In my experience with the House of Compassion, that was not the case. We had many rescue vehicles headed to that facility, that house, on Menon Road in Cumberland, and the outcomes were, pretty. So we're pleased that we're in a different spot today than we were 25 years ago. According to the CDC, the daily medication known as PrEP reduces the risk of getting HIV by 99% when taken as recommended. This means that these medications are the best tools we have to prevent the spread and work towards the eradication of HIV. But this will only work if we break down barriers to access, which means treating these medications just like any other type of preventative medication. The legislation I'll sign into law shortly will require the coverage of these drugs by health insurance plans at no out-of-pocket cost to the patient. The bill will also enable pharmacists to prescribe them to eligible patients. This is an important bill and an important step forward. And I want to thank Senator Melissa Murray, along with Rep. Potter, to kind of leading the charge in many ways in the General Assembly with their colleagues, and all the advocates who helped get this important piece of legislation over the finish line. And I can't leave without saying thank you to Dr. Bailey and the leadership that you have provided, that the health department that has impacted the state of Rhode Island, not only as we were recovering, after Dr. McDonald, left. By the way, he now is the health director in the state of New York. So just to let you know, we have really quality people that work with us in the state, and I'm really proud to be able to work with them as well, and certainly Dr. Pandy is an example of that. So, Doctor, thank you so much. And now I'd like to invite our bill sponsor, Senator Murray, up to say a few words. Senator, thank you so much. And I was with you in your home city, in my second city, in Woonsocket, which Larry knows very well, Health Club up in Woonsocket today, that we ran for 30 years as a small business. Just got converted to a Boys and Girls Club that is really close to me and my family. So, Senator, the floor is yours.
Thank you so much, Governor. Thank you to Open Door Health for hosting today. This is a great day for Rhode Island. I'm so excited and honored to be here on behalf of the Senate. I just want to thank, there's so many people to thank, all the advocates, the medical professionals, Dr. Nunn, Dr. Chan, Chris Federico, Senator Alves, so many staff members that helped this bill to get to passage and just worked so hard to make this legislation possible. And I want to thank you, Governor McKee, for being here to sign this legislation into law. It really is important. I also want to thank and recognize my legislative colleagues for their hard work and support, including folks who have joined us today. Leader Pearson, who was a very staunch advocate of this bill, Senator Mack, Senator Valverde, Representative Morales, and Representative Potter. Thank you all for your support. So I'm old enough to remember when contracting HIV meant an automatic death sentence. And when those first cases emerged, very little was known about the disease. And by the time most patients presented with symptoms, they only had months to live. And in the US, when the disease was first seen in already marginalized communities among gay men, intravenous drug users, and sex workers, public policymakers were slow to respond. And I have friends who recount stories of attending nonstop funerals during that time. I watched as dozens of their friends, their lovers, and their chosen family members died, one after the other. The history of this epidemic is fraught with stigma, discrimination, and disparity based on sexual orientation, race, and socioeconomic status. But this history is now one of hope. The fact that we have drugs that prevent transmission of HIV is remarkable. And some people might even call that revolutionary. But a cure for a disease cannot be revolutionary unless it is accessible to all people. That's why this legislation is so important, because ending the HIV epidemic here in Rhode Island and across the US is now within our reach. By allowing pharmacists to prescribe these treatments, we are also ensuring that they are easily accessible for all patients. PrEP and PEP treatments are tested, they are safe, and they are highly effective. In fact, these treatments can reduce HIV transmission to nearly zero, and we should be proud that our state has been a national leader on this front, and we have made amazing progress over these short few years. So what we are celebrating today is a critical step to ensure that no one lacks access to PrEP and PEP because of cost, especially our most at-risk members of our communities. And this legislation will ensure that Rhode Islanders have sustainable access to life-saving preventative tool that will make a real difference in everyone's lives. I'm really honored to have sponsored this bill, and I remain committed to the work to end HIV in our state. Thank you all so much for being here.